Hello, my name is Jeremy Steger, and I will be going over intervertebral disc disease and muscular dystrophy. First one we're going to go over is vertebral disc disease. This is diagnosed through MRI, CT, and X-ray, along with a physical exam that's very extensive and focused on back pain or the region of the pain. Next, we're going to go over clinical manifestation, lower back pain, decreased reflexes, progressive weakness, and bladder and bowel incontinence for IDD. For IDD interprofessional care, we want to limit the spine movement, treat with ice and heat, get the patient a massage, or have them do massages currently. Use a TENS device, which is a transcutaneous electrical nerve stimulation, which will reduce pain. However, this is temporary. Treatment for this is physical and occupational therapy. Exercise, massage with a mild chiropractic technique. We don't want to put a lot of pressure on the back for stretching, as this can increase pain. We can also do surgical interventions such as intradiscal electrotherapoplasty. Sorry, butchering this one, but radiofrequency disc. Sorry, I had to get some water there. So radiofrequency disc nucleoplasty. Some medications they can have is NSAIDs, opioids, muscle relaxers, or epidural corticosteroids. So my nursing intervention will be chronic pain. These patients will pretty much consistently have chronic pain, as intervertebral disc disease can affect the entire body and how the body moves. So they can have hip pains, leg pains, all kinds of pains that derive from their back. Some nursing outcomes we want to do is only do exercises that are tolerable for the patient's pain level. We want to make sure that the patient doesn't overexert themselves to make them hurt even more or cause more pain. We want to use self-reporting to identify activities that increase the pain, and then record a tolerable level to ensure that the patient has activities that they can do to increase mobility but reduce pain. Interventions for this would be to recognize that patients may need anti-inflammatory medications to treat their chronic pain. This will reduce the pain by reducing the inflammation around the spine or region that is affected. We also want to make sure that they establish a medication regimen that reduces the chances of opioid addiction or the overuse of corticosteroids. IDD education can include reduce strenuous activities, rest regularly, attend therapy, get massage sessions to reduce tension, and to maintain medication management. So for these people, we want to make sure that their job is not very strenuous, as it can accelerate their disease process. IDD patient education, we want to use proper body mechanics, have them stretch regularly, maintain medication regimen, and have the patient regularly follow up with an orthopedic doctor. Next, we'll go over muscular dystrophy diagnostic tests. This is genetic testing. There are a few different genetic tests to determine what has been done for this, but we want to make sure that we test for muscle serum enzymes, ECG, and muscular biopsy. We want to make sure that the heart is running properly, as it is a muscle that can be affected by this disease. Clinical manifestation for muscular dystrophy is muscle weakness, difficulty walking, frequent falls, difficulty getting up from a chair or lying positions. Intervertebral care, interprofessional care for this is PTOT, rehab, neurological focus for an ND or for MD. Ensure that the patient has a pulmonologist, cardiologist, and endocrinologist is noted so that they can provide orders for different diagnostic tests that could be affected by MD. MD treatment, I want to make sure that they maintain exercise and activity, use braces and aids as needed, and then have them take corticosteroids as needed, and then have them on a medication like Vyondase 53, which is a protein creating medication that will increase muscle production. My nursing diagnosis for this is risk for disuse syndrome. Basically, if you stop using your muscles with this disease, you will wither away into nothing. You will have no muscles, you'll be continuously falling, you have difficulty walking, difficulty doing anything. And if you can imagine, all that pertaining to the heart also. Outcomes, we want to reduce pain level as needed or as mobility increases, and that the patient will have bladder and bowel control. Interventions for MD, passive range of motion to maintain muscle function, use assistive devices such as braces, canes, and walkers to aid mobility. So to evaluate this, we want to make sure that the patient is doing all of these core functions along with maintaining their muscle function and muscle mass. We want to make sure that they have all the equipment they need to maintain mobility and to continue using range of motion at the least to increase muscle mass. Muscular dystrophy education. We want to make sure that patient knows that we need to monitor their cardiac output, or need to have a pulmonologist on site or following the patient, and an endocrinologist to make sure that they can monitor for abnormalities. MD usually is found in young males, usually below the age of 30. Here are my references. Thank you.